Hi, my name's Rowan. I'm one of the representatives here at MediRent. Today, I'll be doing an unboxing video for you of our DOT device, which is an electrostatic oscillation therapy device. In the bag, you'll have your device stand, baby powder, white leads for the electrodes, grey leads for the titanium element and applicator, spare electrodes, a charging unit, the titanium element for patient handhold, the applicator unit, as well as a small and large applicator head. We also provide premium vinyl gloves to utilize with the electrodes. I'll now go through the DOT device setup. There are multiple ways in which you can utilize this device, either through the gloves or the applicator. To begin with, I'm going to explain how to set up the applicator method. You'll take your device, and at the top, you'll see your charging port, and then the two holes for the applicator leads. Simply take the grey lead, which you'll note has a narrow end and a wider end. The wider end is for the titanium element. Push this until it's firmly seated. Next, take your other lead and utilizing the wider end, push until it's firmly seated into the base of the applicator. The narrow ends can now be inserted into the device. There is no preference in order in which they're plugged in. The element is utilized by the patient, held either between the fingers or in the fist or between the toes. The applicator is handheld and utilizes either the small head or the large head, depending on what is the most appropriate for the tissue of the patient. Simply twist until locked and you're ready to go. If you would prefer to utilize the gloves when you're treating your patients, keep the grey lead and element plugged in, but instead take one of the white leads, which also has a narrow and a wider end. Take one of our electrodes, plug it in to the wider end until firmly situated, and simply place at the top like you would your applicator lead. The electrode should be positioned typically on your dominant hand, on the inside of the forearm or the outside, pending your preference. Lastly, if your patient prefers not to use the titanium element, you can utilize the device with two electrodes. So in the same manner that we did the setup before, plug one into an electrode that's situated on yourself, and then plug the other white lead into an electrode placed onto the patient. Again, typically in and around the area that you're treating. When it comes to choosing between the applicator or utilizing gloves, it is entirely up to the patient and the therapist's preference. Typically, we've found that the gloves have been the preferred method, as this provides a greater tactile feedback between yourself and the patient. However, the applicator is fantastic for self-treatment, as well as treating areas such as genitals in and around areas that the patient may or may not be as comfortable for you to use your hands. Once you've selected your preferred method of application, whether that be through the gloves or the applicator head, the next step is ensuring that the patient's skin is adequately dry. We recommend using a talc-free baby powder to help facilitate this electrostatic circuit. When it comes to using your device, you'll note you have the screen and 5 buttons. On the front, you have the central button, which is to turn the device on and off, as well as acting as the primary selection button. On the side, you have the up and down, which is to select through menus, and then a back button and a play button. I'm going to show you now how to select the preset mode for lymphedema, which is under continuing care. To begin with, I would select the large button. At the top, you'll see I have custom protocols, or I can go down to our preset options. Lymphedema is under continuing care. I would select that with the large button. I would then move down again, utilizing these side buttons to highlight lymphedema and select. I'm now in the lymphedema preset mode. If I'm happy with these settings, I can move on to the next step. If I would like to change any of the timings here, I simply highlight the time, select with the central button, and then using the up or down arrows to change the time. Once I'm happy with this, I simply select the button and it is now static. I can use the up and down arrows to adjust the different stages. As you can see, stage 1, 2, and 3 are all options within this preset mode of care. The hertz and frequencies that each stage is at cannot be changed within the preset modes. If you wish to do this, we recommend you change them in the custom presets. If I'm happy to begin, I simply press the play button, turn the voltage up. This will just vary the intensity for the patient. Typically recommend starting at around the 50% voltage and then hitting play again. You'll now note that the timer is slowly running down. This timer matches the stage and length of duration that you've selected in that preset or you've adjusted to. If at any point you wish to move on to the next stage without waiting for that timer to run down, simply press and hold the play button, which will now highlight stage 2. To end or pause, press the button once, or press and hold the back button to go to the start of the program. When it comes to setting your custom protocols, this is located on the main screen once you turn the device on. You'll see at the top, I simply select. You have 5 different favorite options. Select again, and within this, you can now adjust the different stages, either removing stages or adjusting the frequencies. I would simply select and now select. I can now manually increase the frequency of each stage. Once I'm happy with this, I can then change the top end as well as the bottom end of this frequency. This preset will now save until the next time you use it. So we recommend using the existing presets initially, finding out what works for your patient groups, and then creating the customs accordingly. When it comes to charging the device, you do have to charge the device when it is not in use, as you have to slide the top over to expose the charging port. It is charged via USB-C that simply plugs in to the wall. The top 4 things that we commonly get asked when setting up the DOT device are as follows. Number 1, using baby powder. We strongly recommend this as this dries out the skin. Number 2, making sure that regardless of which applicator or glove that you're using the correct wiring. Gray for our applicator and our titanium element, and white leads for our electrodes. And then, when using these, making sure that the leads are actually firmly seated into the element, the applicator, or the electrode. Lastly, the question we get is regarding voltage intensity. As I demonstrated earlier, we typically start at around 50% intensity. This just relates to the intensity of the signal that the patient and the therapist feel. This does not change the frequency at which the device is operating at. Simply titrate this according to patient preference. Typically with the higher frequencies, we will find that voltage intensity can be higher. At the lower frequencies, with the deeper oscillation, some patients may not tolerate higher intensity outputs of 100%. Simply change this pending their preference and yours.